Okay, I'd like to call the meeting of the Social Services Committee to order. To start, Majority Council, can you please call the roll?
Sure, Mr. Chairman. Mr. Fine,
Here.
Commisso,
Here.
Brewski,
Here.
Cleary,
Here.
Smith, Lockhart,
Here.
McLaughlin,
Here.
Hurley,
Here.
and Simpson.
Here.
8 present, Mr. Chairman.
Thank you. First on the agenda is approving previous meeting minutes.
Yeah, you're going.
Motion, Mr. Cleary.
Second.
Second, Mr. Brewski. All in favor?
Aye.
Opposed? Okay, passed unanimous. Okay, next on the agenda, number 2, current business. Authorizing various agreements regarding the gun violence prevention program and amending the 2021 Department for Children, Youth and Families budget. Commissioner Manning.
Yes, good evening, everyone. It's unfortunate we're back to this, doing it not together any longer, but at least everyone is safe. We would like to request legislative authorization to accept $115,000 from the New York State Office of Children and Family Services. And this is for their gun violence prevention program. Therefore, we would need to amend the 2022 budget for the department. And then we'd also request going into contract with an authorization for the Boys and Girls Club in the amount of $75,000 and for the House of Hoops for $40,000. This money was added to the gun and violence prevention from the new governor, and she wanted this expedited so they can utilize programming for these youth and to hopefully avoid any further gun violence in the city of Albany.
Thank you, Commissioner. Mr. Cleary.
She said amend the 2022 budget. Did you mean 2021?
I'm sorry, yes, you're absolutely correct. And it's written wrong on the, it should be amending the 2021. So there's a typo in the actual narrative.
Thank
I'll
you.
have that changed.
Thank you. Ms. McLaughlin.
Okay, thank you. Those amounts that you gave, are those are one-time?
Yes, and this did come from the governor's office. They directed us on how they wanted the money distributed.
Okay, now, did they identify the recipients or did we identify the recipients?
They identified the recipients.
Okay, so you said the Boys and Girls Club, House of Hoops, and who else?
That's it, just the 2 of them.
Okay. And 40,000, and I'm not looking at it because I had a little eye surgery, so I can't read.
Oh dear, 40,000 for the House of Hoops and 75,000 for the Girls and Boys Club.
Okay, and they are free to use that however they wish?
Yeah, they would actually be using it for programming. So the House of Hoops, again, is doing a lot of, you know, the exercise, the sporting events.
Yeah.
I know the Boys and Girls Club are doing a lot of art. They're doing wood art and they're doing basically a garden project and a parks program, music and theater.
Okay, thank you, appreciate that.
Sure.
Thank the governor.
Thank you. Thank you, Governor. Thank you, Ms. McLaughlin. Are there any other questions? Mr. Grimm?
Yeah, thank you, Chairman Fine. My understanding is this money is targeted towards certain hot zip codes, I think they call them.
Yes.
Who is served by this money in particular? Is it all the city of Albany or is it the money spent anywhere else? Can anyone answer that?
I would have to look into the zip codes are not listed on the materials I have, but I can definitely get you that information.
Yeah, because some zip codes, of course, they cross municipal boundaries. So obviously I'd like to know what are the zip codes and where is that money going?
Mr. Chairman, if I might interject there,
Yeah.
I don't presume to know officially, but based on where these 2 organizations are housed, I know they serve 12202, 12204, 12206, and 12210 specifically, but they have young people that come from all over to participate in their programs. So I would imagine while they are housed in the city of Albany, they do probably get young people from other cities as well.
Yeah, no, if we had that on that, I'd love to, I'm curious where these people are from that are in the groups. If they're serving outside the city, I'd like to know that. That'd be helpful. Thanks.
I will get that information for you.
Thanks very much. Thank you, Chairman.
Thank you. Thank you, Commissioner. One question. So do you know, are they expanding with this money? Are they expanding the number of kids that they have the capacity to do programming for? Are these existing programs, but they're bringing in more youth?
Correct.
Okay.
There was at the beginning of the summer, through the Youth Bureau, we received $50,000 and people had presented proposals. These proposals, two of these proposals were ones we awarded through the Youth Bureau funding for this gun violence prevention. And then basically we just received notification last week from the governor's office that she wanted to add to that money $115,000, but she selected who would receive that money.
Okay,
So they are expanding because now they have the ability to do so.
great. Yeah, I mean, I think this is very much needed. Gun violence is really hurting a lot of communities and impacting a lot of people. And one of the things I keep hearing from people is that youth programs are, one of the most effective things we can do is getting more things for, productive things for young people to do.
Absolutely.
I'm very glad that this funding is coming through. Are there any other questions? Okay, is there a motion to approve? We have a motion, Mr. Bruschi. Is there a second?
Second, Carolyn.
Second, Carolyn. All in favor?
Aye.
Aye.
Opposed? Passed unanimous. Okay, now number 3 on the agenda, authorizing an agreement with Berkshire Farms and Family Center regarding non-secured detention services.
Thank you, Chairman. The department wishes to go into an contract agreement with Berkshire Farms, who provides non-secure detention services. Non-secure detention services are for those youth ages 7 to 17 that are involved in the family court system and are charged as juvenile delinquents. They have basically been in business for quite a period of time. They will serve both males and females on their campus. And basically, if all of you remember, we used to have Samaritan Shelter, but that had closed about, I want to say 5 years ago now. And Berkshire has been providing this service for Albany County since that period. There's no other, if you will, game in the town that basically they're the only entity operating non-secure detention.
Thank you, Commissioner. Are there any questions from the committee? Okay, hearing none, is there a motion?
Motion.
Mr. Cleary, motion. Is there a second? Mr. Bruschi, second. All in favor?
Aye.
Opposed? Passed unanimous. And number 4, authorizing an agreement with Children's Health Home of Upstate New York regarding reimbursement of Medicaid care management services provided to children in Albany County.
Thank you, Chairman. The department would like to seek legislative authorization to go into this contract with Upstate Health Home, and it's called SHUNY for short. And basically, this is our case management services, which has changed now to health home care management. It's our traditional targeted case management that we've had for years. So our case managers are working with the seriously and persistently mentally ill children in the county, and we get reimbursement from the health home through Medicaid if they meet that criteria. Again, we don't turn anyone away, so we also have non-Medicaid children being served in the care management program. It's a valuable service for Albany County, and it's an opportunity to get Medicaid revenue and get reimbursed for the services that we're providing.
Thank you, Commissioner. Are there any questions? Hearing none, is there a motion?
Motion, Carolyn.
Motion from Ms. McLaughlin, second. Mr. Cleary, all in favor?
Aye.
Aye. Oppose? Pass unanimous. Okay, moving on to number 5, authorizing an agreement with Equinox Incorporated regarding residential domestic violence services. This is Commissioner McClave, and thank you, Commissioner Manning, for joining us. Commissioner McClave?
Hi, good evening. Yes, we're looking to renew a contract with Equinox for the residential domestic violence services. We are required to have a contract with a certified domestic violence shelter to provide safe shelter services. This is, they are approved by OCFS to provide this service. This is a contract up to for $700,000, mix of federal 45%, state 20%, and county 35% reimbursement. We have a state set rate of $99.32 per day per person in the shelter.
Thank you, Commissioner. Are there any questions from the committee? Hearing none, is there a motion to approve? Mr. Bruschi, second.
Second, Carolyn.
All in favor?
Aye.
Oppose? Pass unanimous. Okay. Number 6, authorizing an agreement between the Departments of Social Services and Mental Health regarding services for Safetynet and Tanf applicants and recipients.
Yes, we're looking for authorization to renew a memorandum of understanding between Albany DSS, Albany County DSS, and Albany County Department of Mental Health for their central management unit services, which will provide assessment and a treatment plan development for our DSS applicants and recipients of temporary assistance. This is required by federal and state regulations to have folks assessed if there's a potential that their substance abuse problem is severe enough to interfere with their employment. So Albany County Department of Mental Health does that service for us and makes referrals to substance abuse treatment if necessary. This is a contract of $228,000, 29% federal and 71% county.
Thank you. And Commissioner, so this is if someone applies for specifically for TANF or the Safetynet program.
Correct.
Sometimes they have to be screened if there's, how is that determination made if they're screened for substance abuse?
We conduct an extensive interview once we authorize temporary assistance benefits. Then the eligibility examiner has a series of questions that are state created to screen folks. And if they kind of answer yes to a number of these questions or explain that they do have a substance abuse problem, we make a referral to the CMU.
So they do get help if they do have an issue?
If they choose to accept it, yes. They are referred, if they have an issue that the CMU identifies, can be handled through treatment, then they're referred to treatment by the CMU.
Okay, and what about benefits? Are they still eligible for benefits? Or
they have to be in compliance, which means that they have to be working on the issue. If they're going to counseling, if they're going to assessment, if they're going to preparation for treatment, there's all kinds of activities that they have to be engaged in. If they simply don't show up to treatment appointments multiple times, then they could potentially be sanctioned.
And actually, the question I have is now with marijuana being legal, is that considered, if they're using marijuana, is that considered substance abuse? Would they have to go to a treatment program?
Well, we haven't gotten any specific guidance on marijuana. However, they're only referred if the substance is creating a problem for their lives to the point where they're not able to engage in employment.
Okay, so if you were to detect that someone was, admitted that they occasionally smoke marijuana, that likely wouldn't cause them to be referred or to need treatment.
Not necessarily, no. I'm assuming people might answer occasionally I have a beer, and that would not necessarily generate a referral. So I assume it would be the same with marijuana. I can't 100% say that because I don't think the state's caught up to that yet.
So are we expecting at some point there'll be new state guidelines about explicitly about the use of marijuana?
I would imagine, but again, it has to be to the point where it's a problem for the individual. So the
Okay.
use of the substance is to the point where it's becoming a barrier for the person.
Okay, thank you. And I see Ms. McLaughlin has her hand up.
Thank you. In regards to that, in terms of it being a barrier, does that mean they're not meeting their goals? Are their goals specifically set through the program, or are they just not functioning at a level and that's acceptable? Who would refer them if it were a problem? So for you to know it was a problem.
Their employment caseworker at DSS. So,
Okay.
I mean, we may not become aware of it initially, and we may have them referred to, for instance, the Altamont Employment Readiness Program, and then Altamont may identify, okay, they're not coming to our sessions, they're not doing their trainings, they're not doing what they're supposed to. And they've identified now that there's a substance abuse problem. So at that point, it could come back to a referral to CMU. So it could happen any time along the path. Sometimes people sit down with us and they say, yeah, I use such and such every single day, or whatever it is.
Well, there could be functioning alcoholic, a functioning marijuana smoker, a functioning whatever.
Yeah, I don't know if we would I don't think we would say that, but it's only if it becomes a problem.
But if you don't know that, that's my point.
Yeah,
You don't
exactly.
know.
Exactly. If they're functioning, we probably aren't going to find out.
Okay, thank you.
Unless they ask us for help. They also could say it's a problem for me, and then we would make a referral also.
Okay. Thank you.
Thank you, Ms. McLaughlin. Are there other questions? Mert, did you have a question? No? Okay. Thank you, Commissioner. Is there a motion to approve?
Motion.
Okay, I think we got a motion from Mr. Cleary, second from Mr. Bruschi. All in favor?
Aye.
Opposed? Passed unanimous. Okay, now on to number 7. Authorizing agreements with New York State Office of Children and Family Services and Bright Side Up Incorporated regarding registration services and administrative costs.
Yeah, so we're looking for authorization to enter and renew an MOU with DSS and OCFS, and with DSS and Bright Side Up, formerly known as the Child Care Coordinating Council. OCFS has identified Bright Side Up as the certified agency to conduct registration of child care programs, investigation of complaints, and assistance for people looking for child care programs. DSS is 100% federal funding. We're basically passing it through from OCFS to Bright Side Up. And we get a $12,000 administrative fee to pass this through.
Great, thank you. One question I have, I know I've asked you a few questions both in these meetings and outside about the child care program, and I recently did some outreach about it. And it seems like from conversations with you, it's underutilized. People maybe aren't as aware of it. It seems like it may be beneficial if we put some funding towards outreach. Some outreach for the program, doing some advertising. Do you think that would help in getting more people to sign up?
It's hard to tell. I mean, we do, as we've talked about, we do outreach with our provider agencies, and they know about the program, and hopefully they are telling people who might be eligible. It's only a subset of folks that are going to be eligible for our program. So it's 275% of federal poverty level or below. That's our program is actually 201% of federal poverty level or lower, and WDI is up to 275. So I think that the state should be doing outreach and engagement and paying for advertising for that childcare is available and that this program is available. I think it should kind of be on their dime to do that. It's their initiative. It's they control the childcare centers, license them.
Yeah, okay, thank you. Yeah, I think I just want to make sure it's being as utilized as possible. And I know it's 100% federally funded. So it's a, opportunity to get people in, a program that's really going to benefit them that doesn't cost us anything. So just want to see what we can do, whether that's us doing it or advocating for the state to do more.
Yeah, I think we've gotten an uptick from your outreach, actually.
Good. Yeah, I did some door-to-door passing out the flyers and also posted on social media. So hopefully it made a difference.
Yep.
Good. Are there any questions from the committee? Okay, is there a motion to approve? Mr. Bruschi? Thank you. Is there a second?
Second by Carolyn.
Lachlan, second. All in favor?
Aye.
Aye.
Opposed? Passed unanimous. Okay, so the last item on the agenda, number 8, authorizing an agreement with the U.S. Department of Agriculture regarding the 2021 SNAP Process and Technology Improvement Grant and amending the 2021 Department of Social Services budget.
Yes, so I came to the committee, I think last time, or maybe it was in July, to request permission to apply for this USDA SNAP technology grant. And so we received the award. We were granted the award. So we're looking for permission to accept the award, which is $853,751. And it's 100% federal USDA funding coming to establish a call center for SNAP applicants and recipients, and to purchase a software program that is going to track SNAP activity and data and case management activities. It also provides funding for furniture and miscellaneous training and that kind of thing for staff, and provides for 100% of staff reimbursement for a year once the program gets started for the first year. So we're looking for permission to accept this grant, and a portion of it will begin in 2021. The bulk of it will be active in 2022 at this stage.
Great. And I remember, is this the one that the grant we applied for and were not awarded, and then we applied again this year? So
Yeah.
when it was
Yes.
competitive, right? Only a certain number of municipalities were awarded it.
It was a small amount of money, but they did add some additional funding to the grant, and and we got one of the grants. So yes, this was I think maybe even our third time applying for this.
Great. Okay. Yeah, this is great. I'm glad we were awarded it. Are there any questions from the committee? Is there a motion to approve?
I have a question.
Is that a question?
Yeah, thank you, Chairman Fine. Yeah, you said that the first year will be reimbursed by the feds. Who pays for the money after the first year for the call center employees?
It's the same as our SNAP program employees are currently, which is 50% federally reimbursed. So our current staff is 50% federally reimbursed for
So the
SNAP.
county, when you say 50, so 50% county would be responsible for the
Yep.
employee.
This grant actually is paying for 3 staff that we would have been paying for the first year. It's also covering 3 staff that we were using anyway. So it's saving the county during the first year, especially that 50% in addition to all the funds that.
But in all the subsequent years, then it's going to be a greater expense for the county to pay half the salaries then, right?
It will be some expense, yes. But right now we have my SNAP director just told me last week she has 800 calls pending. I mean, we have to do something because we cannot keep up with the volume of calls and inquiries and applications that are coming in for SNAP. The volume has just been astronomical, and we've been behind in our SNAP staffing complement. We have over 1,300 cases per staff person, which is untenable. We can't keep up with the work. So we do need additional staff one way or the other, whether this grant pays for it or not.
All right, thank you. Thank you, Chairman Fine.
Thank you, Mr. Grimm. Thank you, Commissioner. So do we have a motion to approve? Mr. Bruschi, is there a second? Mr. Cleary, all in favor? Oppose? Pass unanimous. Okay, so that's it. Thank you, Commissioner McClave. Do we have a motion to adjourn? Mr. Cleary, second. Mr. Bruschi, all in favor?